But anyway, it's a great privilege to be back at the Complete Streets Forum for this 6th iteration of this important meeting. This is the second time in not too many weeks that I've been on the same podium with my colleagues from the City of Toronto, Jennifer Keys-Matt and Stephen Buckley, who you're going to be hearing from shortly. And I think that this is further recognition, if any was ever needed, of the close connection between urban planning, transportation planning, and health, and particularly the health of populations in cities. So why is public health a part of that? A part of that triumvirate? Well, of course, it's because of the important health benefits of moving around urban spaces in an active way, using our muscles. In addition to reducing pollution, and we know there's a significant burden of illness that we all bear as a result of the air quality that we experience. Walking, cycling, taking public transit are all ways that we help reduce that burden of illness, but perhaps more importantly is the chronic disease prevention potential of shifting people into more active modes of transportation. We know that a very small proportion, well, less than half of the population in Toronto are actually getting enough physical activity to be healthy, and the potential for reducing obesity, diabetes, heart disease, cancer, and so forth from being more active just in our day-to-day moving around our communities is very significant. And of course, if we hope to see that kind of shift to a more active modal share, it has to happen along with attention to safety, because there is also a burden of illness associated with accidents and injuries that occur every year for both pedestrians and cyclists. So in addition to the health burden, there's also a very significant economic burden associated with chronic diseases, associated with physical inactivity, and this is just one of a number of studies which show shockingly large estimates of the economic burden associated with physical inactivity in Canada, in this case $5.3 billion, with obesity, one of the main outcomes associated with physical activity, $4.3 billion, and it's important to bear this in mind, that half of our provincial budgets go into health care. When people talk about the costs of improving infrastructure for active transportation, these are some of the costs that we are already bearing with the systems that we have in place now. And of course, at the population level, there's an important relationship between how people travel around and how healthy they are. This is some national data, national level comparisons, which show an inverse relationship between the share of people who travel in active ways through walking, cycling, and public transit, and obesity levels. And you can see that the North Americans on the left-hand side of the spectrum are kind of outliers when it comes to large urban developed centers. This is some fairly old data, and we think, based on more recent information, that this is changing in Toronto, but not a very large proportion of us actually choose to get around in ways that are active for our day-to-day work, for going to school, for going to work. If we could achieve higher modal shares of active transportation, there would be real health benefits, and it's possible to calculate what some of those benefits might be, and there's a few notes on this slide about that. And there are modal shares in other cities that show us that it is possible, but if you want to look at it another way, you can take a look at analysis of how we currently move around. And it is true, I think, through this analysis that there are many more potentially walkable trips that are available than are walked in Toronto, and there are many more bikeable trips than are biked. So that's another, I think, way of looking at the potential that exists for us to move around the city in a more healthful way. There are clearly many reasons other than distance that people are choosing to travel in a more particular way rather than another, but this analysis suggests that there is room for change which would be beneficial to health. Now, of course, for some time now, many planners, transportation engineers, and community advocates have been urging that we move in this direction, that we become more active in the way we move around. What does public health have to contribute to all of this? Well, I think we can define the benefits in health terms. And I think that's important to people. It's important to our expenditure patterns. It's important to how we feel about ourselves. Last year, we released a report called Road to Health, which explored the evidence for the relationship between transportation patterns and health outcomes, and identified some strategies which could help us move in a more healthful direction by making active transportation options more attractive, easier, and safer, to help us achieve those health benefits which are potentially there for the taking. Following that report, the Board of Health asked us to work with the Transportation Services Department in the City of Toronto in order to do some demonstration projects to try to, working with local communities and working with our partners in transportation to demonstrate some practical on-the-ground measures which can be taken in order to shift transportation patterns at the neighborhood level. This is being done with public consultation and with measurement of the results. Now this is a work in progress, but we're certainly hopeful that this will enable us to build a practical roadmap for change at the local level, which can supplement the kind of policy work which is already being done. The demonstration projects are going to help us, we hope, learn how to implement concrete changes on the ground, which will help enhance the shift at the neighborhood level and improve health and safety at the same time. So I'm looking forward to being able to share the results of these demonstration projects when they are complete. And I really appreciate the collaboration that we've had with both NGOs, with community advocates, and with our colleagues in transportation services. So thanks very much for your attention. For a few brief remarks, I hope you have a productive day and that this event helps move forward the active transportation agenda in Toronto and beyond. Thank you very much.